With us now, we have Steve Matewa. So Steve is going to present Haiti's particular implementation of Building Health International's Oxbox solution. Back to you, Steve.
As you have already heard, my name is Steve Matewa. I'm a biomed for Build Health International. Next slide, please. So, the thing we have to look at is like, why are we here, all of us? You will notice here the report from World Health. It says 28% of the health facilities and the 34% of hospitals, they could have what we have like access to electricity. That means they could have they have not like stable electricity. And also the survey shows that in low limited countries, in low limited resource countries, half of the hospital health facilities, they have uninterrupted access to oxygen. So what I'm trying to bring here, we have been hearing about oxygen, but I want to bring something that also comes with oxygen. For one to produce oxygen, there's something that we need, which is power. In mid-sized facilities in low resource settings, the barrier mostly is the cost and also the unstable supply. This made BIH to come up with the Oxbox. This is a simple technology at a low cost. That next slide, please. That BHI put together, the engineers put together, so that they can, at least in areas where we have power challenges to power our equipment, we can plug the Oxbox and at least generate oxygen. Next, please. So the Oxbox, it's I'll start talking about the Oxbox. Kind of moved out of oxygen. The Oxbox is powered by a Tesla a Power 2, and it's a 13 kilowatts. That's the battery, and also it's a DC to AC inverter, and you put it in a enclosed box. The module, you can also power it with solar or existing generators to the side. Now, why did BIH come up with this? You look at it, that's the cost. It's affordable, it's expandable, and you can scale it up. And it comes with the 2 oxygen concentrators, a pulse oximeter, and the cable, a gateway, and a skewer enclosure. You can also scale it a little bit if you add a more power cell, and that means you'll be able to at least power 15 concentrators. That if you split one concentrator for 2, then you have like 2 patients on 1 concentrator. It comes with a longer cable. Most of the areas that this is meant to be, the electricity is a big challenge. So it comes with it's reversible. You have a 7 kVA, a 7 kilowatt generator, and also a solar module. Next slide, please. So, yes, thank you. So this is the reason why BIH come up with the Oxbox. This is a site in the rural Haiti, and when COVID started hitting, and BIH come up with the Oxbox and planted there, so that at least they can connect the oxygen concentrators and at least save lives. Next, please. This place is so rural. Next, please. Is so rural that they don't have electricity, and to bring in the cylinders, it's not easy because of the roads. So this is one of the technicians. He's putting up this the solar panels, and we have these are the guys also. They are trying to secure it because the area is so remote. Next, please. Now, one of the challenges that what we have learned after installing the Oxbox is, as we know, COVID needs high flow oxygen, and we are using 10-liter concentrators. That's another challenge. And again, these are remote areas, and the solar panel, you need to secure that. And the other thing is, these are remote areas, they don't have electricity. So once we install this, they need lights, they need to charge their mobile equipment and all that. That's another challenge. That the module, anyway, it supports 5 to 10 liter concentrators and up to 10 patients. If you scale up, as I said already, then you also increase the number of patients and concentrators. And the other thing is we need to start looking at we need to scale up the oxygen concentrator, like the flow. Okay, at least there's most of the ones that we are using there, like the minimum is 10 liter per minute. If we can go up, I guess that will help, and then we'll go to the Oxbox. Then in the rural area, you'll be able to support at least more people, more patients. And the other thing is to try to play around with the 10 liters, see if we can combine them, then bring at least 20 liter capacity. And we also have to explore the battery options. Next, please. The additional solutions that we are doing now is we are doing the survey of all PSAs. We have studied in Malawi, at least we have covered 2 sites. And from Malawi, we are going to Burundi. Then we might cover some, at least 15 more vulnerable countries in Africa. The other solution is we need to, I think everyone has been talking about this, give at least intensive trainings to the technicians who are working on this, and make sure we make some kind of follow-ups. The upkeep sometimes is a little bit low. And now these are
Steve, sorry to cut you short. Just some concluding remarks, please. We're running a bit short of time, so that we don't use up the Q&A.
Oh, thank you. So my conclusion is, I just want to say we need to give more training to the staff on this site, and this has proved in Haiti that it has saved time and lives when COVID hit, and there were like no flights coming to Haiti because they had already trained the team on the ground. It was easy for us to troubleshoot and support and make sure we bring the oxygen plants back working without any challenges. Thank you.
Thank you very much, Steve, for this interesting presentation.